Hello, my name is Paul Smith. I'm a certified emergency room nurse and I work in an ER in downtown Charlotte at Atrium Health. I'm here today as part of a collegiate debate to debate North Carolina House Bill 235, otherwise known as the Opioid Epidemic Response Act. This bill was signed into law on July 22, 2019, and it was signed into law by Governor Roy Cooper. For the sake of today's argument, I would like to act as if the bill is still on Health and Human Service on the Subcommittee for Health and Human Services. I would like to begin today with my pro-arguments for this bill. The first subsection of this bill removes a waiver that will allow providers to prescribe bupropion, or otherwise known as Subutex. When Subutex was used in the treatment of withdrawals versus traditional methods of methadone, there was a decrease in mortality rate. Secondly, with the removal of the waiver, this will allow providers to be able to provide more help in keeping patients on their regimens to fight off withdrawals. And lastly, with a decrease in mortality rate and greater adherence to the treatment regimen for withdrawals, registered nurses such as myself will see a decrease in ER visits for opioid overdoses and an overall decrease in mortality rate. The second stance I would like to say for my pro-argument is that the fact that the second subsection allows for the testing of substances. This will hopefully be useful for law enforcement because they will be allowed to track certain chemical elements, which will hopefully lead to arrest of major drug traffickers and suppliers. And lastly, the bill in the third section calls for a clean needle exchange, which will decrease the rates of HIV, hepatitis C, and bloodborne infections. This has been proven numerous times in numerous studies. This will benefit us overall because there will be a decreased amount of cost for treating these diseases. Now for my against statements. This bill does not do enough to combat the opioid crisis. Currently, there are 41 out of 100 North Carolina counties which are considered opioid high-risk use, and most of these counties are rural counties with inadequate provider coverage. This bill does not address the underlying issue, which is provider coverage. I would like to ask that this bill be referred back to the subcommittee and that the bill shall have some riders written in that provide for better provider coverage. At this time, I cannot support this bill unless there is better provider coverage. Thank you so much for your time.